Hi, I'm Stephanie, and I'm here with Dr. Ward. I've been Dr. Ward's hygienist for 17 years. We've moved down to Tulsa about 5 years ago, where we place implants exclusively because you've been accredited with the American Board of Oral Implantology. You've done all of this accreditation, all this extra schooling. So that kind of sets you apart as far as implants go. So what we do all day, every day is we place implants.
Yeah. The accreditation part and all the things you can see on the website in terms of what we have done to differentiate ourselves, I think for me, my heart is we've got to protect the patients, and we need to, as an industry, step out and say, this person has spent the time, they've learned implant dentistry, they've learned the surgery, they've learned the prosthetics, but we're going to be able to protect the patients and have very predictable results based on science, based on all the things that we know to do. In a lot of cases, when you're in the realm of full arch stuff like this and all the implants involved and the sinus surgeries, and that's probably the biggest reason that I went through and did all my accreditation stuff.
So would you say that that's your passion, placing implants? What is it about implants that drew you to them?
That's a great question. It's really not the implants. I love surgery. I've always loved surgery, that component of dentistry, but it's really what I found for me is it's the place where I feel like I'm helping people the most. When you take someone that's hurting or embarrassed or can't go outside, just doesn't want to be seen, all those things, and you feel that with them, and you take them from that point to a finished product where they're crying and so happy, and whatever that feeling is, I love it. I don't know what to say about it. It's a motivator. The implants help retain the teeth. It's all a big system. There's a lot of things involved from start to finish. You started with me, and initially you did hygiene, and that was your thing, and then now you're my surgical assistant. You've done that for 6 or 7 years now. We went and learned lab technician, and you're a porcelain technician, and there's just all these aspects to you being involved in it. But I think for us it was having control of the products, so at the end of the day we gave the patient the best opportunities to succeed. And I think some of the things that I find in this industry are it's such an investment to do these all on 4, all on X type procedures, that how do you make it a price point where people can move forward and say yes, but give them something quality enough so that it's going to last and work for them. And as a team, we've brainstormed and tried to figure out how can we do this, and really it was try to bring everything in-house and be an expert in every aspect of that. So whether it's the surgery, whether it's the temporaries and how we do that and how we develop occlusion, or when you start the permanent ones, how do we take records and how do we do that the best that it could be done? And then we're making the teeth. Really, we just brought everything where we have control so that we know it's done right. So we decrease our personal expenses a little bit, and that helps, but it's that we have the predictability of it. I think that's the biggest thing that we get with that. But no, I love all of it. I've always liked working with my hands. I've always liked being outside doing stuff, just tinkering with stuff, but this is just what I love to do.